Hi, my name is Dr. Daniel Fox, licensed psychologist in the state of Texas and an expert in the area of personality disorders. And today we're going to talk about treating narcissism. And you'll notice that there are exclamation points and question marks in the topic because there's a lot of differing views and different perspectives on how, or if it's even possible, to treat narcissism. So in this video, what we're going to do, we're going to discuss that. And one of the big issues is that narcissism is majorly misunderstood. Most of the time it's lumped into a picture of an extreme conceptualization of resistance, demonstrative behavior, and a grandiose type of individual. However, the reality is that it's on a continuum like all other disorders. This means mild, moderate, severe, and extreme. Now in this video, what we're going to unpack the concept of narcissism, the two types, and the question, can these individuals benefit from treatment? The big question is it possible that they could benefit from treatment, and can it be done? So hang out, let's unpack it, and let's explore it. Let's see what we can do here. And don't forget, like, share, and subscribe, and please leave any comments that you may have in the comment section. I do encourage folks to make it positive. I'm trying to create a very positive environment for people that either have personality disorder traits, as well as those who may have loved ones who have personality disorder or personality disorder traits. So let's get into it. Most individuals along the narcissistic spectrum do not seek treatment. Now, recall I said most, and most is not all. Now, to understand this, we need to talk about the two sides of the same coin of narcissism. So that's kind of what I call it, right? And on the one side is this grandiose type. And the other side is this vulnerable type of narcissism. Now, this is also called overt and covert narcissism as well. Now, these two forms of narcissism, they share several characteristics in common, such as self-centeredness, exaggerated sense of self-importance and entitlement, disagreeableness, and a tendency to interact with others in an antagonistic manner. Now, the difference, though, in how these manifest, and that's what we're going to do here. So your grandiose type is what most people think of when they hear narcissism. These individuals tend to have a grandiose sense of self-importance. They exaggerate achievements, talents, expects to be recognized as superior without commensurate achievements. And what that means is that, right, they don't really do amazing things, but they constantly want to be told that they're amazing. They are preoccupied with fantasies of unlimited power, success, brilliance, beauty, and ideal love. They deserve ideal love. And if you will ask them, well, what is your ideal love? Typically, they can't describe it, or if they do describe it, it's very general terms. It's very hard to get specific details out of these folks. That's because if they're specific, they can be held more accountable. If it's operationally defined, then they can be held accountable in a much more clearer fashion. Okay, but I don't want to get ahead of myself. Let's keep going. Now, for your grandiose individual with narcissism, so this, of course, is also your overt narcissism, right? And now this individual, they believe that he or she is special and unique, can only be understood by or should associate with other special people of high status or be affiliated with high status institutions like universities or companies, things like that. So middle of the road stuff, they're going to avoid it because it doesn't really allow them to bask in that reflected glow. And they require excessive admiration all the time. I like to refer to it like petting the kitty, right? Is that you have to always be petting the kitty. You always have to go back, and the kitty always wants to be pet, and you're constantly petting the kitty. And that's this admiration. You know, they also have a sense of entitlement. This is that unreasonable expectation of especially favorable treatment or automatic compliance with his or her, I'll get it, expectations. But again, these tend to be very vague, non-specific. So you're supposed to figure it out, because if they were specific, then they could be held accountable, and they don't want to do that. So they speak in very vague terms. They're often interpersonally exploitive. They take advantage of others to achieve their own ends. So if there are a lot of passive-aggressive tactics, so if they could trip you up to their own advantage, they're certainly likely to do that. Your failure somehow is their success. That's kind of their conceptualization of the world. They lack empathy in many cases. They're unwilling to recognize or identify with the feelings and needs of others. And this specific trait is often where that confusion comes between antisocial personality disorder and narcissism. Now, antisocial personality, just for a moment, that they tend to have this very broad conceptualization, right? So that lack of empathy tends to be just so massively pervasive, and they're out to get power and profit. Whereas for your narcissist, that lack of empathy is, again, it's not necessarily power and profit, but it's recognition. It's this ability to see that I'm special, that I'm unique, the things that I can do, the things that I bring to the table constantly, constantly, constantly. So that becomes a lot of the confusion and that overlap, but it's not as destructive and pervasive as it is an antisocial personality disorder. It doesn't mean it's not destructive and pervasive. What that means is it's not as destructive and pervasive, but you can have folks that have narcissistic personality disorder with antisocial traits. You can have individuals with antisocial personality disorder with narcissistic traits. So it depends, and it gets really confusing, which is why it's so important that we tease these out, right? Very carefully when we're talking about diagnosis and treatment. So let's keep going though. Don't want to digress too much. All right, so these folks are often envious. We're back to the overt type of narcissism, that grandiose, so often envious of others, believes that others are envious of him or her, even though there may be no evidence in the environment. They're often arrogant, haughty. Their behaviors are very, sort of snooty. And they have this snooty-like attitude in dealing with others, particularly if they perceive those others to be beneath them. Now, let's compare and contrast with vulnerable narcissism, your covert narcissism. Now, in these individuals, they're very defensive, very avoidant, a lot of insecurity, and they wear it more on their sleeve. Both types are insecure, but the way that it manifests, they're hypersensitive. They'll tell you how much they're hurt. They'll tell you how much they're wounded. Very vigilant for criticism, always on the outlook of being insulted, being hurt, being seen as less than. They also need people's recognition all the time. Remember, petting the kitty, that's a common one. They like to go back and pet the kitty. This is the kitty. Petting that kitty, right? To bolster their sense of self-worth. Now, they feel underestimated, and when they feel underestimated, this can result in withdrawal and passive attitude, passive-aggressive even, right? Attitude in interpersonal relationships. Okay? They have very low self-esteem. They tend to be solitary and reserved, detached from others, critical, careless in a lot of ways, selfish, cold, resistant to participate in situations, as well as very sensitive and nervous. Okay? They also hold a negative view of the past and tend to see it as a very fatalistic manner, very pessimistic. Nothing will ever work out. Poor me, poor me. And the way this is a narcissistic component is that, and I hear this a lot in the folks along the narcissistic spectrum that I have worked with, and what they say is, no one suffers as much as me. No one knows how much I suffer. No one knows the extent of how much I suffer and pain and that I go through. It's, again, remember, narcissists, they want to shine, they want to show. So your covert narcissist wants to say, I shine and show by how much I hurt, by my level of vulnerability, by my degree of brokenness. Now that we've talked about the two types, let's kind of put them together. What about treatment, right? Because there's a misconceptualization that is an either or, and it is not. So in treatment, here is kind of how it works out. And there really aren't a lot of research studies. There aren't efficacious approaches to treat narcissism like there is borderline personality disorder. But if you think you're perfect and that you have no flaws or problems, which is that inherent issue, even for that covert narcissist, although my brokenness, although I want to shine by how much I hurt, there isn't that drive to seek treatment because it's a perfect sense of brokenness. And if you remove that sense of brokenness, right, with therapy, which is the therapy that I do, is guided towards repairing that core content, right? We'll talk about that briefly in a moment. But it's about repairing that. But why would they do that? Because then what happens? Where's my coping strategy? See, a lot of personality disorders are maladaptive coping strategies. So it's about learning to do it differently, becoming more adaptive and moving away from those maladaptive strategies that we call personality disorders. So again, if you're perfect and have no flaws, whether it's covert or it's overt, right? Why would you seek treatment? Or why would you participate in research studies? They don't. Okay. Now, Also, though, they get such a reward from their maladaptive patterns, right? Like we talked about, they don't seek treatment, such as typically it's due to avoidance. They're sensitive, detachment from others causes others to seek them out in a poor baby moment. So, when they're hurt, someone may come up to them and say, oh my God, you went through this and all this, and that's petting the kitty, right? That feeds their sense of narcissism. Doesn't mean you're making their narcissism worse, but what it does is that it reinforces that sense of narcissism and what they get out of it, but you're not making the narcissism worse. That's a whole nother video and a whole nother issue. But those with narcissism do come to treatment. Now, when they incur a narcissistic wound. So what is a narcissistic wound? So a narcissistic wound is something has occurred, something has hurt them to such a degree that their narcissism, that conceptualization of their world, fractures. So when that fracture occurs, they're unsure of themselves, they're frightened. Now, underneath that core content for your narcissistic individual tends to be guilt, shame, doubt, inferiority is often what is underneath. So imagine that something happens. You get fired from a job, right, that gives you a lot of status. Your boyfriend, girlfriend, right, breaks up with you, and he or she was wealthy, or he or she had a high social status in your social group. Then they break up with you. So then you get this fracture. So what do? That narcissistic wound has to be repaired. Now, typically what you see is a maladaptive approach to repair that narcissistic wound. And the way they do this is very maladaptive. Sometimes, if it's a significant other or a spouse, whatever, significant other, and in that case, then you might hear, you're not going to leave me. If you leave me, something horrible and drastic, right? Or no one else can have you, you have to be with me. No one else will ever be with you or anything like that. Those are very narcissistic, maladaptive statements. But what happens is once that paired with that narcissistic wound, they have to put that back together. So sometimes what happens is you are put on, and I'm not being flippant. I'm using this as to explain, is that what happens is that you are put on an aggravation installment plan, okay? Which means that you have to be put through the paces of pain in order for that narcissistic individual, right, to again feel safe, so that their narcissism is restored, which really, if they worked to restore their narcissism, it would be quicker, it would be easier, right? You wouldn't have to suffer so much, they wouldn't have to suffer so much. But remember, personality disorders are maladaptive. So they engage in maladaptive behavior strategies to repair that ego state, to repair that narcissistic wound. Now also, it's important to recognize that the wound may drive them to treatment, but when it heals to the point that their ego is stabilized, they usually leave treatment early. So it's hard for them to commit to stay the paces, to stay the course through treatment. So one of the things that typically happens is that the individual with that narcissistic wound will then exhibit a lot of covert narcissistic traits, right? The ones that we went through, this hurting and this pain and so on and so forth. So then they may come and see someone like me or a psychologist or mental health provider, whoever it is. And there's no medication to restore it. I mean, there's no medication to restore or to repair guilt, shame, doubt, inferiority. It doesn't work. That's why medication only treats surface structure content, not core content. And if you want more about that, that's in a ton of my other videos. You can check those out. But so what happens is, so they come to treatment, right? And this is not your typical, standard, grandiose presentation. So they come, and the therapist in many ways doesn't know that what they're doing is that they're restoring an ego state in someone that has a narcissistic personality disorder that tends to be covert type. So what it is, you work with them, then that ego gets restored, right? Then that sense of hurt or that sense of conceptualization of their world that becomes maladaptive gets repaired to the point that they can go back to what I call default behaviors, right? Default patterns, which is our immediate go-to behaviors, thoughts, patterns, right? Which in the case of a personality disorder are maladaptive, which reinforce the personality disorder. So you go back to that. They go back to that, then like, I don't need to go to treatment, bye. And then they bail. That's typically the course. That's typically what happens. But despite the lack of treatment outcome research on narcissistic personality disorder, there is a wealth of clinical treatment reports. Those are like case studies or stories and things like that clinicians have written to help other clinicians get a conceptualization. Now, these reports share two common similarities. Narcissism is difficult to treat right? And the treatments are often not effective. Bummer, right? For the very reason that I just described. And one key in treatment is to form a strong alliance with the client. The alliance is crucial. It is central. It is so important to encouraging the client to remain in therapy, because if they can remain and that ego, right, gets restored. But if you can speak to them, and I call this speaking narcissism when I teach other mental health providers how to work with folks with these personality disorders, I call it speaking narcissism. You have to speak to them in a way that they'll hear you, that they'll understand. And then if you can do that, you can build that alliance. They might stay with you. So we want to encourage them to stay in treatment, because if they stay in treatment, maybe we can attenuate some of those narcissistic patterns, right? And go from maladaptive strategies to adaptive and healthy strategies. And you do that by not only confronting that core content, but also giving them adaptive strategies to get their needs met in a much more healthy way. You don't have to put somebody through the paces of pain in order to feel good about yourself, in order to show proof that that person genuinely loves you, cares about you, so on and so forth. So for the narcissistic individuals who do and have stayed in treatment, I have found the classic core content of the narcissistic individuals, right, regardless of which side of that narcissistic coin they're on. So that's important, right? And they have to stay in treatment. It's important that they stay in treatment, that they like the person that they're working with. And interestingly enough, many people call me and say, hey, no one will treat narcissism. Do you know anybody who does? So on and so forth. There are not a lot of people out there who do. Most of them are in big cities, but it is possible to find them. But I think what's critical is if you're an individual who believes that they're along that narcissistic spectrum, it's important then to be evaluated by a mental health provider to determine if those traits are present. Don't worry necessarily about the whole disorder, right? Putting that stamp on there. We want to see is those traits are present that are causing problems in your life, because then what we can do is we can hone in on treatment and we can attenuate, lessen the severity of those maladaptive patterns that keep causing these narcissistic wounds in yourself, causing disruptions in relationships, causing you to lose jobs, so on and so forth. It is possible to do this. It is possible. I can tell you I've worked with folks with narcissistic personality disorder. I've had, I think, a lot of really good success with them. It takes a long time. It's a difficult process. It's a very slow process. But they can learn adaptive strategies if they are willing to do it. You're not going to talk your partner who's along narcissistic spectrum into treatment to change. You're just not going to. They're going to bail early, just like I said earlier, for those very reasons. So they have to make the choice to do it differently. They have to make the choice to confront that negative sense of self, that core content, guilt, shame, doubt, inferiority. So that is where they have to come in to treatment. That recognition is so, so important. And I hope you enjoyed the video. Please like, share, and subscribe. Leave any comments you might have. And thank you for your time and attention. Take care. Bye-bye.